It's very interesting to think of where we're at these days, specifically with Roe versus Wade and Dobbs and all that's going on with reproductive health justice. I also think it's important to understand where reproductive health justice and trauma services prevention intersect. And so this next year, Gender Justice LA, myself specifically, is in the Solis Policy Institute, specifically thinking about how we could pass a bill around TGI reproductive health care. And I think it's important to acknowledge that when an individual starts hormones, in the informed consent model, the paperwork that we sign essentially says that we'll be infertile for the rest of our lives. And I think that really has struck a chord with me in many ways as someone who would like the option to parent. And so I think about as I get older, the way in which trans, gender nonconforming, and intersex healthcare doesn't come with like a future forward thinking in mind in terms of how we access hormones. And so I would love to see more programs specific to trans, gender nonconforming, and intersex folks within reproductive health care. Maybe when you sign up for hormones, you also get 1 year access of sperm banking or egg freezing of sorts. So I think it's just important to think about how we're creating more spaces for TGI folks to really fully show up as themselves, whether it be the right to parent or right not to parent.
Here at Amador County Arts Council, we are working with several coalitions that are focused in one way or another on inclusion, diversity, equity, and access. And of course, that includes mental health for LGBTQ plus folks. Just the act of meeting together and making safe space for us to exist in our community is already a symbol of hope, and it is a motivator to keep people thriving and helping us feel visible when frequently we feel unwelcome and invisible. Additionally, some of those coalition activities include the Department of Behavioral Health in Amador County and the LGBTQ plus roundtable that behavioral health is currently hosting and has been hosting over the last year or so. That is creating a welcoming space for members of our Out for Mental Health task force to come into the behavioral health department and share feedback. It is a safe space for all kinds of feedback and input, and that group of LGBTQ plus folks and allies really has demonstrated a unified commitment to normalize rural LGBTQ plus lives. And I know from growing up in Amador County as a kid and feeling invisible and unwelcome, that work today to normalize queer plus lives, and not only does it help with my own mental health and the little 6-year-old and little 15-year-old that still lives inside of me, but I see it helping kids today. I see it helping LGBTQ plus seniors today living in rural spaces, and I see it helping parents and families. The Out for Mental Health grant is helping us learn and feel empowered to celebrate the space that we take up whether or not we feel welcome.
For us, we started out initially with an adult-led task force. And it was in the middle of the height of the pandemic. We were able to receive some funding that was in line with one of our objectives, which was to have a phone line, a crisis line specifically for LGBTQ folks in Alameda County. And now we are shifting gears to build out a youth task force. So really hearing from youth. What are you seeing? How do you feel about wellness and therapy, even around language? Like how safe do they feel meeting with a non-queer therapist, or really just hearing from them what changes that they want to see.
So right now we're doing some work with our county. We do have allies in our county, and those people are very supportive. It's very hard to make systemic change, but right now what we're working on is doing cultural sensitivity training at our county, and really at any organization that asks us. We do those trainings in schools as well. And we're working on putting together LGBTQIA2S plus competent providers to share with our county, in the hopes that they will use those resources and continue to use NorCal Outreach as a resource in the community as well. Really appreciating the partnership and the resources that Out for Mental Health provides is really instrumental in the work that we're doing, and has allowed us to continue to do that work in a way that I think is impactful for our community.
So my approach to kind of seeing how the system works and how I can personally make change is kind of, I guess, in a very small approach, because I am just one person. I myself am engaged in the mental health career, so I'm finishing school to become a marriage, family, child counselor or therapist. And what I've seen is the lack of knowledge that is given to us as students. So really, in those spaces where the conversations are needed, I try to inject that conversation with LGBT competent information, affirming information, and really providing that education as a student to not only the educators but also to my classmates, and utilizing those resources of sharing information. Like, I have other students who share information about stuff that I wouldn't know about, and really helps me in the work that I do. And so sharing that knowledge is so important, but really acknowledging that not all mental health providers are competent in this, and that it's about the education, right? The ongoing education, and seeking out those education opportunities so that you can become more competent in that care. And so just trying to be that example, and hopefully try to mandate some type of education for our providers, so that not only for LGBT issues, but for other intersectional identities as well, that we need to continue that education, because we can only work from the sphere that we understand ourselves to be.